59 by Assemblywoman Aguilar Curry and others, inoculating human papillomavirus.
Assemblywoman Aguilar Curry, you may open on the bill.
Good morning, Mr. Speaker and colleagues. In the United States, 37,000 cases of cancer and 7,000 deaths are caused by HPV every year. AB659 will increase uptake of the cancer-preventing HPV vaccine by guaranteeing that the vaccine is completely covered by all public and private health plans. Parents will be notified of the expectation for the HPV vaccination in the method already used at the choice of the school district in the statistically prevalent languages of the school population. Vaccination will also be an expectation of students entering UCs, CSUs, and California community colleges. Out of respect for the impacts on school children of not attending school during the pandemic, I have removed the requirements that school districts and higher education institutions confirm or enforce vaccination, meaning those unvaccinated students can still attend school and higher ed. With the removal of the enforcement, AB 659 passed Committee 10-4 and Appropriations 11-4. It is supported by numerous public health advocates, including CMA and Planned Parenthood. I respectfully ask for your aye vote.
Thank you, Ms. Aguilar Curry. And Assemblywoman Rubio, you're recognized on the bill.
Thank you, Mr. Speaker. I rise today as a co-author of AB 659 and want to thank my colleague from Winters for authoring this measure. Members, this policy isn't complicated and it shouldn't be at all controversial. Over 30,000 cases of cancer were attributed to HPV infections just last year, a cancer of which we have a safe, proven, and effective preventative medicine. 30,000 cases of cancer. We have had the tools to prevent the overwhelming majority of these cases for years, yet failed to fully utilize them. It is my hope in my lifetime we find a comprehensive cure for all cancers. In the meantime, this measure plays a critical role in reducing the number of families impacted by HPV and the cancer complications associated with it. Members, please join me in supporting AB 659, and I respectfully ask for an aye vote.
Thank you, Ms. Rubio. And Assemblywoman Ortega, you're recognized on the bill.
I also rise today as a proud co-author of AB 659 and applaud the author's work on this important bill. I also rise as a mother of a teenage daughter. AB 659 simply notifies families of sixth grade students that they are expected to receive this life-saving HPV vaccine before they enter the 8th grade. This is a life-saving bill, cancer-preventing vaccine, and I urge your aye vote on AB 659.
Thank you, Ms. Ortega. And Assemblymember Joe Patterson, you're recognized on the bill.
Thank you so much. I rise regrettably to oppose this measure. I know that the author has worked very hard, and I appreciate the amendments to take out the mandate. Right now, the language says that schools must notify parents and students about the expectation from the state that they receive the HPV vaccine. I think that conversation's much better had with the doctor on whether or not that's should be something that's done. And also, I think that when adults are going to students and they're saying, hey, you're expected to do this by the time you reach 8th grade or before you go to high school or before you're 26 years old, what naturally are they going to think? They think it's something that they need to do. And finally, even though I already said that, I'm also concerned about exactly how this might potentially be interpreted by a judge someday, because we are developing right here a public policy that the state expects people to get vaccinated. And will a judge ultimately make a decision that, well, the expectation is of the state, the legislature's spoken, the governor signed the bill, and you need to get the vaccine? So with that, I ask for a no vote.
Thank you, Mr. Patterson. And Assemblywoman Friedman, you're recognized on the bill.
Thank you, Mr. Speaker and members. The previous speaker mentioned that if a letter is sent home to parents, that the people reading that might think that getting this vaccine is something that they're, and I think the quote was, expected to do. That's exactly right. I'm a co-author of this bill. I'm also a cancer survivor. My grandmother also survived uterine cancer. And for years, people have said, imagine if one day there's a simple shot you can take to prevent cancer. Well, you know what? That's now a reality. This is a simple, safe shot that's been used by tens of thousands of girls across the country. And the result has been only that numerous cancers were prevented. Now, we're talking about children. We're talking about young adults here. Children are not by law allowed to make their own medical decisions. There is a limit to what children can decide. And we have also decided that it's in the public good that we as a society protect those children, even if their parents are reluctant to do so. We don't allow parents to decide to withhold medical care from children. There are numerous court cases that say there's a certain level of base care that you're expected to provide as a parent, whether you want to or not. You have to provide a level of nutrition. If your child has a serious disease, you have got to treat that disease, even if your religious belief says you don't believe in science or you don't believe in medicine. We expect you to get vaccines that we know will save that child's life, and because of that, we don't have polio ravaging children. And in this case, we can prevent cancers. So yes, parents have some rights, but when it comes to stopping a preventable cancer, we should as a society do whatever we can to urge that family to take that preventative step. This bill doesn't force anybody to do it. It simply notifies them that's reasonable. We hope that they do what they should be doing for the sake of that child. Now, they may not believe in science. They may believe that their child deserves cancer if they engage in sexual activity, but that's not where we are as a society. We say we want to protect those girls from a purely preventable, spreadable cancer. With that, I urge an aye vote.
Thank you, Ms. Friedman. And Assemblyman Mathis, you're recognized on the bill.
Thank you, Mr. Speaker. Members, I was actually happy to see the mandated language taken out of this, but I think the question today really comes down to, is it the place for us as a state to have it in our schools that we're going to tell our kids, hey, you need to go do this, you need to go get a vaccination, or is it the place for the parents, the families, the doctors to have that as a family conversation? Clearly, there's different beliefs, as the previous member just spoke. What concerns me is that the idea that the state is going to be the parent is fundamentally wrong. The idea that the state is going to tell us as parents and take that right, the ability to be a parent, to have the conversation, the opportunity to actually figure that out away, is fundamentally wrong. Granted, some of you might think it's the job of the state to, and we've seen the tweets about it, you know, go live in your green government home, go to your green government job, send your kid to your green government school, ride green government transportation, and if you don't like that, we'll send you to our green government re-education. That might be what you all believe. Thank God we live in a republic and not a democracy. I ask you for a no vote.
Thank you, Mr. Mathis. And Assemblywoman Pappen, you're recognized on the bill.
Thank you, Mr. Speaker. I, too, rise as the mother of a teenager. And this bill is about prevention. And my God, why wouldn't you take the opportunity to have prevention of things like cervical cancer? The World Health Organization says that cervical cancer is the 4th leading cause of cancer for women in this world. I just can't understand why we wouldn't be voting for this bill. As HPV is mainly transmitted through sexual contact, most people are infected with HPV shortly after the onset of sexual activity. Moreover, HPV vaccines work best if administered prior to exposure to HPV. That's why providing a defense against HPV as early as possible is critical to preventing the potentially devastating effects of these cancers. This is particularly true for women and girls. This bill represents a compromise effort, and I thank the author for making those compromises along the way. Informing parents about the benefits of the HPV vaccines and establishing requirements for screening will be tremendous tools in the efforts to reduce the incidence of these many cancers. We have the knowledge. We have the tools. Let's use them, and let's save some lives.
Thank you, Ms. Pappen. And seeing if there are no other members wishing to speak on this bill, Ms. Aguirre-Curry, you may close.
Colleagues, HPV cancer rates are at 37,000 every year, yet over 60% are eligible adolescents who have not received the HPV vaccination in California. 135 million doses of HPV vaccine have been distributed in the United States since the vaccine was introduced in 2006, giving ample time and exposure to prove its efficacy and safety. AB659 fosters an uptake in HPV vaccination at the ideal age range for the vaccine and does not mandate or enforce vaccination at any education level. This bill ensures there is proper communication with parents in locally prevalent languages. Lastly, this bill removes cost barriers and guarantees that the HPV vaccine is completely covered regardless of health insurance and status. It is my honest intent to set an expectation of students with this bill, and that is exactly what it states. There is nothing misleading about this. Remember, there's a similar practice of vaccination requirements without enforcement that is already in practice with hepatitis B vaccine, where students at the 7th grade level are required to be vaccinated against hepatitis B, but no enforcement is done by schools. Members, I've been working on bringing this proposal forward for 5 years. During that time, over 203,000 Americans have developed cancer, and more than 35,000 people have died from HPV-related cancers. Members, have a backbone. Have a brass backbone. This is for women and men. This is not just a woman's problem. It's all of our problem, whether it's cervical cancer, whether it's throat cancer, whether it's penile cancer. Every one of those we need to take care of. So don't turn your back on this, members. This is a very important bill. We've taken our amendments. We have listened. And quite frankly, I can't believe I don't have all of you up on this bill for a Cancer Prevention Act. Thank you very much. I ask for your aye vote.
Thank you, Ms. Aguirre-Curry. Clerk will open the roll. All those vote who desire to vote. All those vote who desire to vote. Clerk will close the roll, tally the votes. Ayes